I'm Dr. Trainer. On WKUP Health tonight, we're going to take a closer look at rhabdomyolysis, which is a clinical condition rare enough to be overlooked but dangerous enough to never be forgotten. This is a condition that causes a breakdown in skeletal muscle homeostasis. Back in June, we started following Adam Kudulowski from Platteville, Wisconsin. He's been training intensely for the prestigious Grand Slam Championship game that will be played on December 25th, 2016. Adam is the second-seeded player in this tournament, and he will be facing off against number 1 John McEnroe. Rhabdomyolysis, also known as rhabdo, is a potentially life-threatening syndrome resulting from the breakdown of damaged skeletal muscle cells with leakage of intercellular components into the blood. Muscle injury, regardless of how it's caused, results in a cascade of events leading to too much calcium in the intracellular space, ending in muscle fiber death. In the United States, approximately 26,000 cases are reported annually. This disease occurs most frequently in adult males. It was first prominently noted in victims of crush injuries during the World War II London bombing raids. This led to the formation of the Renal Disaster Relief Task Force. This task force was established after the 1988 Armenian earthquake, when more than 600 survivors developed kidney failure due to crush wounds. It is an international team specializing in renal care and deploys to major disaster scenes around the world. What exactly is skeletal muscle? Skeletal muscle is wrapped by epimysium. Within the muscle are muscle fiber bundles called fascicles, each surrounded by the paramecium, which contains the blood vessels and nerve supply. Within the fascicles are the muscle cells, wrapped in endomysium, which contains the capillary beds. Below the endomysium is the sarcolemma and transverse tubules which surround the sarcoplasm. In rhabdomyolysis, muscle cells are disrupted in the sarcolemma and sarcoplasm. Within the muscle cells are the myofibrils surrounded by the sarcoplasmic reticulum. Myofibrils contain the actin and myosin myofilaments, which make up the sarcomere. The sarcomere is the fundamental contractile unit of skeletal muscle and the structural unit of myofibrils. An action potential travels along the muscle fiber sarcolemma and into the transverse tubules. Within the T-tubules, the action potential triggers the opening of the voltage-gated channels and releases stored-up calcium ions. Calcium floods into the sarcoplasm like a herd of cats and into the sarcomeres. This sets the stage for a contraction involving the interaction between the actin and myosin. Contraction ceases when the nerve stimulation stops and calcium concentrations fall. The calcium channels close and active transport pumps replenish the calcium in the sarcoplasm. Myoglobin is a small oxygen-binding protein found in skeletal muscle cells. Myoglobin functions as an oxygen storage unit, storing the oxygen until it's needed to generate ATP for the energy required for muscular contraction. In rhabdo, myoglobin and creatine kinase are released into the blood, while interstitial fluid leaks into the damaged muscle cell, causing the muscle to swell.
Okay, so.
Go.
Alright, brain fart. I've been training really hard for the Platteville Grand Slam Championship because I'm facing the Johnny McEnroe. So I've been training really hard since June, and unfortunately it caught up to me.
So, what do you mean it caught up to you? What kind of symptoms were you having?
Well, at first I didn't think anything of it. I had a little more muscle pain than normal, and I just thought that was due to my increased training regimen. But then I started to worry when I had intense abdominal pain and my urine was turning a dark brown color. I also felt very nauseous, and I was also running a fever pretty much all the time. I just thought I had the flu or was extremely dehydrated, so I just thought that drinking a lot of water would help. But then the next day, I started feeling my shoulder muscles hurting a lot more than normal, and I could tell that they were swollen and inflamed. That is when I decided to go to the doctor and get checked out.
These signs and symptoms could also be linked to disorders and diseases like heat stress, muscle strain, dehydration, influenza, deep vein thrombosis, and muscular disorders. Rhabdomyolysis can be caused by things like physical exertion, like tennis training, running, weightlifting, and many other exercises, medications, specifically statin drugs, also alcohol, opiates, cocaine, Trauma, commonly crush and compression injuries due to car accidents, falls, or earthquakes, infections, and also genetic and metabolic disorders. With muscle injury, large quantities of myoglobin and creatine kinase leak into the systematic circulation. Some of the tests that can be done to test for this are the urine dipstick test and a blood test. The urine dipstick test is used to test for the presence of myoglobin. In healthy individuals, low myoglobin levels are filtered from the blood by the kidneys and is released into the urine. Normally, myoglobin is barely detectable in urine. With severe muscle damage, blood levels of myoglobin overwhelm the system, and massive amounts of free myoglobin end up in the glomeruli and renal tubules, and the urine levels are high. Too much myoglobin can result in tubular obstruction. Large quantities of myoglobin are toxic to the kidneys. The blood serum test measures the amount of creatine kinase in the blood and is the main test to diagnose rhabdo because it remains in circulation longer than myoglobin. Small amounts of creatine kinase are normally found in the blood of healthy individuals. Rhabdo is associated with significantly elevated levels of CK. Levels greater than 5 times normal are accepted as evidence for the diagnosis of rhabdo. CK levels greater than 15,000 units per liter indicate increased risk for kidney damage. Some different treatment and management options of rhabdomyolysis are hospitalization, which is a way for early and aggressive management. It's hard to determine the risk initially, so you have to plan for the worst case scenario. Also, hydration is the key to preserving renal function. Intravenous fluid, normal saline, until CK levels decrease. Fluid recovery may include treatment for hyperkalemia, which is high blood potassium, and hypocalcemia, which is low blood calcium. Also, medications such as diuretics can help. Treatment of underlying cause when necessary, such as discontinue statin medication, and also dialysis if kidneys need help. Prognosis and recovery of rhabdomyolysis depends on the degree of muscle and kidney damage. In the best case scenario, if this disease is treated early, you will return to normal health and routine within a few weeks to months. Lingering weakness and muscle soreness is common. In the worst case scenario, if delayed treatment, there's complications that can lead to kidney damage, acute renal failure, and lifelong dialysis, also cardiac arrhythmias, even death. We're 2 weeks away from the Platteville Grand Slam Tennis Championship, and we have Adam Kudalowski, who we've been following for the past 6 months here on our show tonight. So Adam, how has your recovery been going?
Thanks for having me on the show, Dr. Trainer. My recovery has been going pretty well. I made sure to stay hydrated. I've been getting a full night of sleep. And I made sure not to overexert myself when I've been training for my next match.
Oh, that's great. So, are you ready for your next match? It's a pretty big game.
So my next match is actually in 2 weeks, on December 25th at noon, and I hope all you guys can come out and support me. I've been training really hard, and I'll be facing the Johnny McEnroe. You know, he's #1 in the world, so it's going to be a great match, and all the proceeds go to the Murray Foundation.
That's right. The tickets are $500, and the proceeds will be going to the Murray Foundation, which is for the prevention of rhabdomyolysis. Have a great night, guys.